The following portion of Daytime is sponsored by the Jason Facial Rejuvenation Institute. Welcome back, everyone. For both men and women, having a full head of hair is important. For males, it's a sign of masculinity and virility. For women, it's about being attractive and feeling confident. Up until recently, hair transplant surgery meant cutting and suturing. But not anymore. The face doctor, Michael Jason, is here to tell us about the graft, and he's brought along patient Mark Wallace as well. Welcome, gentlemen, to Daytime.
Good morning. Good morning.
All right, Dr. Jason, let's talk about hair transplant surgery. And up until recently, it was all about the scalpel, right?
That's correct. For many years, the traditional method for hair restoration or hair transplant was to use something like this, a scalpel, and we would actually cut out a strip of scalp off the back of the head. Then we would take a staple gun like this and staple the wound closed. Staples would stay in for about 2 weeks. Then that strip of scalp is passed off to a team of 3 to 5 technicians who will whittle down the strip into small hair grafts that are then transplanted onto the top of the head.
Okay.
Now, this is called the NeoGraft system, and it's an automated system where we take a handpiece like this and we actually use 1 millimeter punches, no incision, no scalpel, no sutures, no staples, but we make 1 millimeter punches, and then with a pneumatic system there on a vacuum, the hair is pulled into this reservoir here and stored until they're prepared to be reinserted by positive pressure and a reversal of the pneumatic system of the machine. So it's a no-touch way to actually harvest the hair and then replace it in this new location.
So it sucks it out and then spits it back in.
Basically, basically it does, but it does so very atraumatically, which makes it very patient-friendly.
Right. No scarring, no downtime, really.
Right. There's no sutures, there's no incision, there's no scar, and the scar can be very significant after a strip method.
Right.
So this is a huge game changer for hair restoration.
Well, we mentioned that you brought Mark Wallace along with you, and we have a shot of Mark, and I need you to explain exactly what we're looking at here. Okay.
Up top is Mark very shortly after his hair transplant procedure. So you can see little dots where the grafts have been taken. But on the bottom half of the photo, we're 2 weeks out, and you can still barely tell that there's been hair harvested. And what will happen is as that hair grows back out, you won't be able to tell at all that anything was done in the back of the head.
That's amazing. And there's another patient.
And this is a before and after. You can see we went from very little hair on the top of the head to hair covering the majority of the head anyway. And that's huge for a patient like that.
What kind of time frame was that?
Well, it would typically take about 9 to 12 months to get that type of result because there's a process of hair maturation and hair growth that has to take place. The initial hair that we graft falls out, and then over a period of about 3 or 4 months, a new hair grows out. But it may take up to 9 months to get that length of hair growth.
This is something that is of great interest to a lot of women out there.
It's huge for women, because of the scar associated with the strip method, typically wouldn't opt to do hair restoration. So they choose expensive and tedious methods such as extensions to get their hair replaced. The problem with that is, besides the expense, is that the extensions actually damage the remaining hair, so it can compound the hair loss problem. And this is an example of a before and after in a woman patient getting greater density in the top of the head. But another area for women that's very, very important is the replacement of eyebrows.
Oh, yes.
And as women age, it's not uncommon for the eyebrows to kind of disappear. They either need to pencil them in, or they go do tattooing with permanent makeup, which can be actually quite painful, and also sometimes doesn't look very natural.
You're right.
But so this is a way with their own hair to replace the eyebrows and get a much more natural looking product without the downtime.
Very nice. Well, Mark, let's talk about it. How did it feel when you were having the procedure done?
Well, the feeling was not even there. It was just a suction, and that was it. There was no dramatic stress to my body, and by the next day, I was back working again.
Isn't that great?
It's fabulous.
What do you think of the results?
The results feel good.
It looks very natural. It looks great.
It's my hair.
It is your hair. So once you put that follicle back in, it just starts to grow again? Is that how it works?
But the hairs are in different phases, so not every hair grows immediately.
Right.
But it does save that big scar in the back of the head. So if you want to wear your hair short, you won't have the scar to show. And I think we have a brief video showing what a typical scar looks like from the strip method.
Yeah, nobody wants that.
No. That's what it's all about, and the NeoGraft system allows us to avoid that.
Very good. Mark Wallace and Dr. Michael Jason of the Jason Facial Rejuvenation Institute, thank you both very, very much. Hey, to get your questions answered or to schedule a consultation with Dr. Jason, call 813-975-3223 or log on to jasonfacial.com. The preceding portion of Daytime was sponsored by the Jason Facial Rejuvenation Institute.